Erectile dysfunction, often referred to as ED, is a common condition that affects millions of men worldwide. Characterized by the consistent inability to achieve or maintain an erection suitable for sexual intercourse, ED can be a source of frustration, embarrassment, and emotional distress. But the good news is that, for many men, erectile dysfunction is a treatable and often reversible condition. Understanding the underlying causes and adopting a few simple lifestyle changes can make a significant difference. In this guide, we'll explore 5 simple and evidence-based steps you can take to help reverse erectile dysfunction and regain confidence in your sexual health. First, let's discuss the importance of understanding your overall health. Erectile dysfunction is rarely just a problem that exists in isolation. More often, it's a symptom of an underlying health issue such as cardiovascular disease, diabetes, high blood pressure, or hormonal imbalances. Therefore, the first and perhaps most crucial step in addressing ED is to schedule a thorough medical checkup with your healthcare provider. By identifying and managing underlying conditions, you can often see marked improvements in erectile function. Monitoring blood sugar levels, blood pressure, cholesterol, and hormone profiles not only benefits your sexual health, but is fundamental to your overall well-being. The second step to reversing erectile dysfunction lies in improving your lifestyle habits, especially when it comes to diet and exercise. Research has consistently shown that men who eat a balanced, nutritious diet experience lower rates of ED. Focus on including plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats in your meals. The Mediterranean diet, rich in olive oil, nuts, fish, and fresh produce, is particularly beneficial for vascular health, which is directly linked to erectile function. Additionally, regular physical activity is key. Aim for at least 150 minutes of moderate exercise each week, such as brisk walking, swimming, or cycling. Exercise enhances blood flow, reduces stress, improves energy levels, and helps regulate hormones, all of which are crucial for healthy sexual function. Even simple activities, such as choosing the stairs over the elevator or taking daily walks, can add up over time. Step 3 addresses the often underestimated but significant impact of mental health on erectile performance. Psychological factors like stress, anxiety, depression, and relationship problems can all play a significant role in the development or persistence of ED. It's perfectly normal to feel apprehensive about sexual performance, but chronic stress or unresolved emotional challenges can interfere with the delicate balance required for an erection. If you suspect that psychological factors may be affecting your sexual health, consider talking to a counselor or therapist. Building effective stress management techniques, like meditation, deep breathing exercises, or mindfulness, can help calm your mind and improve your overall sense of well-being. Open communication with your partner is also essential. Discussing your concerns or anxieties can foster closeness, reduce performance pressure, and help both of you enjoy greater intimacy. The fourth simple step is to avoid or address the use of substances that can contribute to ED. Smoking, excessive alcohol consumption, and recreational drug use are all major risk factors for erectile dysfunction. Nicotine, for example, damages blood vessels and compromises blood flow to the penis, making it harder to achieve an erection. Excessive alcohol acts as a depressant, negatively affecting the nervous system and dampening sexual response. If you smoke, seek support to quit. There are numerous resources and cessation tools available. If you drink alcohol, try to limit your intake to no more than 1 or 2 drinks per day. Steering clear of recreational drugs is likewise crucial, as substances like cocaine and marijuana can disrupt normal sexual function. By addressing these habits, you not only improve erectile health, but also support better heart health, lung function, and longevity. Finally, the 5th step focuses on the importance of sleep and regular sexual activity. Quality sleep is essential for hormone production and overall health, including sexual health. Men who consistently get less than 7 hours of sleep per night are at higher risk for erectile problems. Ongoing sleep deprivation lowers testosterone levels and increases stress hormones like cortisol, both of which can interfere with erections. Prioritizing healthy sleep habits, such as maintaining a consistent bedtime, limiting screen time before bed, and creating a relaxing sleep environment, can make a noticeable difference. Regular sexual or masturbatory activity can also be beneficial for erectile health. Engaging in sexual activity increases blood flow to the tissues of the penis, promotes the release of nitric oxide, a key molecule in achieving erections, and helps maintain the elasticity and functionality of erectile tissue. In essence, the more often you exercise this part of your body, the better its performance is likely to be. This doesn't mean you need to place pressure on yourself or your partner, but allowing intimacy to be a regular part of your relationship can yield both physical and emotional benefits. Together, these 5 steps form a comprehensive approach to naturally reversing erectile dysfunction for many men. However, it's important to remember that ED can sometimes be a sign of a more serious underlying condition. If you experience ongoing symptoms despite making these changes, or if your ED developed suddenly, consult your healthcare provider to rule out medical causes and discuss medical or pharmacological treatments if necessary. In addition to these lifestyle changes, a variety of medical treatments are available in cases where ED persists. Oral medications, the most common of which are phosphodiesterase type 5 inhibitors, like sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra, are effective in helping many men achieve and maintain erections. Your doctor will help determine whether these medications are appropriate for you based on your overall health and any medications you may already be taking. Other treatments, such as vacuum erection devices, penile injections, hormone therapy, and even surgical options, may be considered in certain cases. Above all, remember that experiencing erectile dysfunction is nothing to be ashamed of. It's a common and often treatable condition. Taking care of your physical and mental health, maintaining open communication with your partner, and seeking medical support when needed, lay the foundation for a satisfying and fulfilling sex life. By embracing these 5 simple steps, monitoring your health, improving diet and exercise habits, addressing mental health, avoiding harmful substances, and optimizing sleep and sexual activity, you put yourself on the path toward reversing ED and reclaiming your confidence. The journey to overcoming erectile dysfunction begins with a single step. By making informed choices and prioritizing your well-being, you can take control of your sexual health and enjoy a healthier, happier life.